Hello, my name is Moshe Heller from Jingshen Pediatrics, and I wanted to thank the American Acupuncture Council for hosting us today. And today I'll be joined by my colleague and dear friend, Stephen Cowan, and we're going to be talking about how to needle kids. Hi, Stephen.
Hi, Moshe. It's good to be here, and I want to thank the American Acupuncture Council as well. This is a great opportunity to talk about something that comes up as a question with acupuncturists wherever we teach is, how do you stick a needle in a child when they're afraid? So
Yeah.
let's go to the first slide and talk about that.
Okay.
So the first thing you notice in this slide, I don't particularly like this picture, but that's
Yeah.
why I put it up there,
Yeah.
because the perception of parents and I think practitioners is the word needle is, conditioned into thinking it's a shot like you go to the doctor and get a shot. And so the very first thing that has to be deconstructed with practitioners and with patients and parents is that these aren't really needles. The word needle is actually the wrong term. It implies something um, that causes pain in a very different way. The needle caliber of a needle like this one, getting a shot, is much bigger. They're not flexible. They have a hole in the middle of them. They have medicine that comes through them or whatever. So all of that has to be deconstructed from the very beginning.
Yeah, and there's probably another one aspect that needs to be, because we've been teaching this in our course, but I also hear a lot of practitioners who are just so afraid to hurt the child. So there's some kind of fear that needs to be addressed in the practitioner also. Just wanted to.
Yeah, it's interesting you say that because, look, I practiced pediatrics for many, many years, drawing blood on kids and starting IVs and doing all these things. And there was a way that you learn to put a child at ease. And the very first thing is um, to recognize the fear that's in the room and try to de you know desensitize that. But actually, if you go to a doctor's office, one of the biggest mistakes doctors make is they'll tell a kid, "Don't look." And that makes it way worse. That actually expands, "Oh my God, it's so bad, they don't want me to even look at it." So
Mhm.
I want the child to look at the fascination. And so the first thing I do is I have them needle me.
Right.
And so they can watch what's happening. They don't see me fainting or freaking out or blood all over the place. They put
Hmm.
the needle in. I hold a little guide tube. Usually I do it at LI4 because I'll really feel that patient's chi when they're needling me. So when a little kid presses that little red needle in, I'll say, "Great." And then I'll remove it. And then they look with amazement and I wiggle it around with my hand and they go, "Oh, does that hurt?" I say, "Do I look like I'm in pain? No. Take it out now." And then they take it out. This is giving an empowerment to a child that nothing's being done to them. And then I bend the needle right in front of them so they can see it's like a hair. And
Right.
that's what I call
Yes.
them. I call them hairs. And all of a sudden, they're fine with it.
I'm going to move the next slide so we can actually
Yeah.
see this in
Oh,
action,
too far.
right?
Oh, yeah. Good.
So yeah, definitely it's important to have the child see and understand that it's okay to look at it, and it's not as um, concerning as getting a shot from a doctor, as you kind of mentioned before.
Yeah, notice the picture though. This is when I had hair, so this was 20 something years ago when I
Yes.
was needling kids in the peds office. But what's interesting is the child's got her eyes on me,
Yes.
right? And there's a developing link that has to happen, where that trust is built by our relationship. She's listening to me singing a song or doing something that's it's allowing her to feel engaged. Also, there's no table. She's sitting on her mother's lap. For the first needling of almost any age under 7 or 8, I have the kids sitting on a parent's lap so they A, feel safe, and B, the mother can feel the chi shift in the baby, which is like a sell point for acupuncture. When the mother
Yeah.
says, "Oh, the kid just relaxed or just chilled out or just what," when the mother feels that, it's like a win-win, right? Because they're a relationship that's very deeply entwined.
Yes, absolutely.
So the deconditioning of what we call needles is step one. The fear comes from building a relationship. Maybe I'll do a little magic first, or maybe I'll do, tuning forks or something else to actually engage the child in our relationship. That's the antidote to fear and trauma.
Right. So I think one other thing I want to point out is that, as we one of the special things about our medicine is recognizing that each patient is an individual, and so
Absolutely.
the way you need to handle children is really dependent on understanding their own, how you can kind of engage with them on their sort of constitution and terms.
Absolutely. That's a huge part of my practice, as you know, and I've written about it, and we teach it in the Jingshen course in pediatrics. And it is really important that we're not treating a piece of meat, that these human beings have unique characteristics, unique relationships, unique information going back and forth with their parents, constitutional styles, all have to be taken into consideration in terms of your approach to the child. A fire
Right.
child may be, a kid with more fire phase, elemental kind of energy is more big energy. They're going to feel something very big.
Right.
Um, a
The most.
water child may be really, really, really afraid of just the whole concept of somebody sticking anything into them.
Right.
Even, look, checking their ears is too invasive for them. And so
Right.
each child's temperament and the relationship with the family are part of the art of pediatrics that may not be as critical in the adult patients a lot of the listeners are dealing with. So this is the art of medicine with children.
Yes. Yeah. And of course, I think another point that I want to just mention is that a lot of times, up to the age of 2, I find it much easier to work with needling in terms that babies don't. I can show them what I'm doing. There's no fear, and then there's
Yeah.
less possibility for sensitivity. After 2, then this kind of phase that you said, about 2 to about the end of the first cycle, 7, that's when we have a little more challenge, and we
And the
need.
reason for that is by between 2 and 3 developmentally, a child is starting to trust labels um, as reality. And in Chinese medicine, we know that labels are not reality. Lao Tzu talks about that. It's not true reality, but you start shifting from the innocence of 0 to 2, and then somewhere around 3, 2 to 3 or 4, the twos obviously there's more drama. It's a
Right.
fiery stage of development. But by 3, now the language holds a reality, and so this is where I'm talking about the word needle, right?
Mhm.
Suddenly, needle has all these implications, and that's why it's more difficult after that age, right? Developmentally, the conceptual mind is starting to expand into, oh no, you're not putting a needle in me, right? And
Yes.
so that's an explanation of why you're developmentally why you're saying it's easier under 2.
Exactly. Yeah,
The innocence is a kind of openness, right?
yes, and
Without language.
also changing the name, like calling it hair, or I sometimes use flags or
Flag.
other terms instead of using a needle is also helpful.
Yeah, yeah. And I also use one word that is an amazingly powerful word
Yes.
that changes the whole dynamic. I say this may tickle a little bit. The
Hmm.
word tickle has both positive and negative meaning in a child. If you're trying to do an abdominal palpation and you say the word tickle, you'll never get your hands on the baby because they're going to be ticklish. But
Right.
with a needle, when you say this may tickle a little bit, that minimizes the fear because the word tickle is fun and happy and silly and jokey, right? So
Yeah.
um, the language we use is Chinese medicine, right? I also spend time explaining points and the names of these points and the power, how each point has a different quality. Sometimes I'll let kids pick the first point, but generally speaking, when you're working with kids, I find, and I believe you do too, that the best first point to needle is LI 11. That's what
Absolutely.
I'm doing here because A, it's a big point. There's a lot of flesh there. There's not a lot of pain fibers in that area. And it's a very powerful, hussy point that has multiple benefits in harmonizing. So it's a win-win. And then they see it and they realize, oh, that's it?
Yes.
Then you can slowly, once you sometimes in kids who are very fearful, I'll just do that for the session and come back the next time and challenge them with kidney 3 or something so that they're starting to trust that this isn't a problem. Then
Right.
when you get into the real treatments, spleen 3 or liver 3 or something where there's going to be some, more
So,
powerful chi sensation, then they can accept it a little more.
yes. Yeah. Also, I really believe that, and correct me if you think different, that large intestine 11 is the stomach 36 of kids.
100%. And often they're a pair that is so powerful in
Yeah.
children because you're covering 80% of the problems kids come in with, right?
Right.
Is, something to do with that, yang ming aspect of their life. So I think that's a good point. I agree with you. I think that's good. Stomach 36, some kids do better with initially. I usually want to massage the point before I need needle stomach 36 just to open it up, sort of ask permission for the
Right.
hair
That's
to
actually, I think, a very important point. I think that massaging the point and not just going right away with any point, even if you're doing large intestine 11 in general, is a good practice for
yeah.
needling kids.
The other thing is the guide tubes help desensitize the actual point because it prepares the skin neurologically to receive that if you go cold without a guide tube, they're going to feel it more intensely as it moves through the outer layers where all the nerve fibers are.
Right.
So just pressing on it, even with your hand, with your finger, will desensitize that and ready it for it to come in.
Right. And that brings us to another thing that we wanted to talk about today. And so I'm going to move to the next slide is that
Right.
actually, a lot of times we think of a needle as our best tool, and it's probably is. But we do have other options, and that's important to master the use of all these other techniques because there, in case there is something that's not working with needling, whether there's too much fear or interference between with that specific child, we have other options, and they're pretty good options as a
What I would
right.
say before we run around these, I agree with you 100%. Not only as alternate options if needling doesn't work, but as options to prepare for needling, right?
Absolutely.
So that each of these techniques can be used to ask permission, so we're not traumatizing a child, to ask permission to work with a particular point. So, why don't you talk about Shonishin because you do so much of it in your office? I think it's a really powerful way for kids to receive a treatment that
Right.
opens them up to the possibility of needling, right?
Right, absolutely. So shonishin is the use of these, we call them gentle tools, that we stimulate points and channels with specific techniques to create, an effect on the channel system. And children usually respond beautifully to this. And it is sort of like a lot of times a preparation for needling. So a lot of times I'll start with a generalized shonishin treatment, which harmonizes the flow of chi in the channels, and then go specifically with more points, either with needles or with another tool that's called a teishin, which we can stimulate, tonify, or sedate any point with those specific tools.
Yeah, the Taitian is particularly fun to use with kids because they can experiment with the spring on it and see how it feels and play around with it, and then you can really work on a point. I like that. Tuina is another obvious massage technique to work on points and channels that also is very effective, particularly in kids who are skittish or hypersensitive, or a lot of the autistic kids I work on really respond amazingly well to, sort of the classical Tuina techniques that we use.
Yes.
And tuning forks I use regularly, both at the point before needling and once I've needled, I quickly pull a large tuning fork, a kind of low frequency tuning fork, and tickle the needle itself. So their mind has shifted away from the fact that there's a needle in them. And now I'm asking them to sense when the vibration, when they're feeling the vibration of the needle. And that takes their mind into a more fun aspect away from the, oh my God, there's a needle sticking in me reality, right? And
Yeah.
and it's a way of stimulating the points using sound, which in some ways I think is more powerful in little sensitive kids, particularly babies, than electricity, which is very strong. This is a gentler way of getting an incredible effect, right? So it's both asking permission with tuning fork, the end of the tuning fork on different spots, right?
Yes.
And then when you needle, you can use it as a way of engaging their attention to the point, which potentiates the effect.
Right. Then Moxa and Tiger Warmer is, I really think that Moxa is an amazing tool to work with kids, especially when they're very deficient, um, and we can kind of use also a Tiger Warmer if uh, the somebody's not familiar with a Tiger Warmer. What a Tiger Warmer is a tool that you put Moxa, or it looks like a moxa incense, into the tool, and then we can apply both heat and pressure with the tool, because the moxa warms the metal end of the tiger warmer, and then you can slide it along different points or different areas in the patient's body.
It's interesting because what you're doing with your hand, we both teach this in the course, this idea, particularly with ear infections, chronic ear infections, or throat infections, or anything where there's so much yang in the head, pulling that down with a tiger warmer, moving the channel, moving the flow, right, is really important. And you're actually demonstrating it with, people who,
Yeah,
kids who have lingering pathogenic factors. It's a very effective way of moving stuff.
absolutely. Yes. So I think we've sort of ran out of time, and we have to sort
Go
of
to the
close
next slide.
out. What's that?
Oh, we had one more slide that was
Uh,
just talking
yes.
about
Yeah.
the,
Yes.
so we
The last slide. Sorry. That is the this is the website of our course, and we would um, be very happy if you visit the website, and if you're interested in learning more about treating pediatric patients. Stephen, any?
Yeah, I want to thank you guys. I hope we've piqued some interest in practitioners out there. I think treating kids is very rewarding for practitioners because they respond so quickly to acupuncture and herbs and Chinese medicine philosophy. And we are, you know, our partnership in this is to really spread that word and inspire practitioners, particularly those who are working in fertility, where now they have a baby that the family may be asking, can you treat? And we want to encourage that. So visit the site for more information about our future teachings.
Absolutely. Thank you very much, Stephen, and thank you again, the AAC, for this opportunity. And thank you very much.
See you soon.